If you're watching this video, it's probably because your pelvis hurts during pregnancy. Pelvic pain during pregnancy can have many causes. Today we're going to talk about them and what you can do to fix it, or at least make it better. Now, before we talk about pelvic pain, let's talk about the pain of not getting prepared for your upcoming birth. I actually have birth plans made easy, even though I like to call them birth preferences. You guys can grab it down below. It's totally free. Come join me. Now, of course, when you're learning about pain, you should definitely be learning from an expert. In case we haven't met yet, hello, I'm Hilary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience. Since 2001, I have been hanging out in delivery rooms, and I'm a top prenatal educator, educating thousands of women online every day. And I know I can help you get prepared for your upcoming hospital birth as well. As a side note, I hope your belly isn't the only thing growing right now. We are really trying to grow our channel. So if you're interested in high quality pregnancy content, please like this video and subscribe so we can hang out for the rest of your pregnancy. Okay, pelvic pain can happen for a variety of reasons. I actually have a video on here about ligament pain. Your round ligaments extend from your uterus all around to the sides of your body, including around your pelvic girdle. And so that can cause that as well. Also, things like a bladder infection can cause pelvic pain, or simply pulling a muscle like down with your legs or anywhere around here, it can cause pelvic pain. And I actually have another video on pain between your legs that you might want to check out as well. However, it's this guy right here that causes most of the issues with pelvic pain. It is called your symphysis pubis. It is actually not bone. It's almost crocheted in your own body, not quite. It is cartilage that allows this to stretch when the baby's coming out. As you can imagine, we need this area to accommodate a baby of varying size, and so it stretches to help baby come out better. Which I think we're all grateful for. We don't need babies staying in there forever, right? Your body produces hormones that allows this to stretch during your pregnancy, again, for that baby to come through. Sometimes your symphysis pubis gets a little extra excited and it starts to open up too much, which can cause your entire pelvis to have some issues. It just causes some instability because this front part, kind of the keystone of your pelvis, just isn't keeping it together like it used to. And in fact, it can actually separate, although that doesn't happen in most cases. This is called symphysis pubis dysfunction. And it's just because this part of your pelvis isn't holding it together as well. And as you can imagine, if this part feels a little wonky, it can actually cause issues in your hips or your tailbone. One of my biggest symptoms with symphysis pubis dysfunction was actually tailbone pain. And they kept thinking something was wrong with my tailbone. But in reality, it was just the shifting of my pelvis that really made my tailbone hurt. So what can you do about it? I think your best friend is going to be physical therapy. There's a lot of activities that you do every day, including getting off the couch, putting on your pants, or getting out of a car that you can do better if you go to a physical therapist. Now, the basic thing that they're going to say is to try and keep your legs together. So when you're getting out of a car, you'll swivel your entire body to get out of the car and then get out, rather than moving one leg at a time, because that is what really puts a lot of pressure on this symphysis pubis that is already pretty angry. Or like when you're putting your pants on and you're moving your legs like this, maybe sit on your bed so that you're not putting so much pressure on your pelvis standing on each leg as you put your pants on. By the way, that was something I never thought of. I saw it later and I was like, why didn't I think of that? I was just standing up and putting my pants on. Ugh. Sometimes we don't do the smartest things. Now, if you talk with your provider and they're just like, oh, that's normal, but it's really affecting your day-to-day life, I actually have a whole video on how to manage pain during pregnancy. I will link it down below so that you can watch it too, because a lot of providers will just say it's normal and won't give you any resources to get the help that you desperately need. By the way, communicating with your provider can be really tricky. We talk about that a ton in the online prenatal class for couples. I'll put the link for that down below as well. Another thing that can really help is a maternity support belt. This is actually a pelvic support belt that I ended up using postpartum. You'll use this around your hips, but I'm just going to demonstrate it up here. The idea is to put it around your pelvic bones and then attach it, and it just provides support for that area for whatever you're doing that day. You'll definitely want to talk with your provider if that's a good option for you. A lot of people wear a maternity support band that just goes under their belly, but this you're going to want to put a little bit lower so that it really helps support your hips. And I think it's really important to talk with your provider or see a physical therapist to make sure that you're putting it on the right way. I know for me, when I was working at the hospital, the scrubs provided absolutely no support to my pelvis. So that is a time that it hurt the most, and using a pelvic support brace helped a lot. And in fact, you might have heard me say that I was still using that postpartum. Once the placenta comes out, your body's no longer producing that relaxin hormone, but it takes a while for this joint to solidify and go back to normal. And so my tailbone hurt for quite a while. I wish I had seen a physical therapist or a chiropractor early on. It actually ended up causing issues that seemed like plantar fasciitis or issues with my knees, because if your pelvis isn't right, that's really the foundation of the lower half of your body, and you want to make sure that it's correct. Again, I wish I had seen a physical therapist or a chiropractor for my issues. Now, if your pain feels much more like up in the inside, now that can be an issue with infection or other things like that. Make sure that you're talking with your provider if you're feeling any burning or something like that on the inside. Like I talked about before, I have that whole video on ligament pain that people absolutely love. I'm going to put a link to it here. But that's it for me and my crocheted pelvis and pelvic pain. Let me know, does your pelvis feel a little bit like it's crocheted right now? I think this is adequate for some pregnant people. Your pelvis just feels wonky, and I hope this video has been helpful for you.